Hello, my name's Miss Lynne Robinson. I'm a consultant gynaecologist and I work through the Priory Hospital in Edgbaston, and also my NHS practice is at Birmingham Women's Hospital, where I lead the menopause service. I just want to talk to you a little bit today about what the menopause is and what symptoms it can cause and what health problems it can cause, and also the good news is what we can do about it. So the menopause is diagnosed 12 months after your last period. So it's when periods stop. And in the UK, the average age of the menopause is 51, but obviously it can happen a lot earlier than that, and it can also happen later than that. It is a natural transition, and if a woman lives long enough, she will definitely go through it. But although it's a natural transition, it can be quite distressing for some women and can cause real health problems and affect the quality of life. For many women, they don't recognise it, or sadly in some cases their doctor doesn't recognise it. So I'm just going to talk to you a little bit about what the symptoms are and how we investigate it and what we can do about it. So the symptoms are variable, and most people think that it's hot flushes and sweats, which are a very common distressing symptom, but actually it's more than that. And women suffer a lot from anxiety and mood changes. They often describe having brain fog and word finding difficulties. Lack of estrogen, which is the hormone that you lack in the menopause, can cause joint pain, muscle pain, and also what women talk about less, but is a very common problem, is vaginal dryness and also lack of libido. So those are a few of the issues. From a point of view of health problems, women that go through the menopause have a higher cardiovascular risk, and also they lose bone. So it's the lack of that hormone estrogen that is linked with that. So what can we do about it? Well, we can diagnose it, and that's most commonly on clinical symptoms. In younger women under the age of 45, we can offer a blood test to help diagnose it, but women over that age, we really do mostly rely on these symptoms. The next thing we can do is sometimes look at their cardiovascular risk, because I think it's a time in life to get an MOT, and sometimes in some cases we will look at their bone density, but not in all women. But the next thing is, what treatment can we offer? Once we've diagnosed it, the most common treatment, which is very effective, is hormone replacement therapy, which is known as HRT. That is primarily the estrogen hormone, and that's the hormone you need to protect the bones, protect the heart, and relieve these symptoms. But in women with a uterus, we will also give a hormone called progesterone, which protects the uterus against abnormal cell changes, which could unfortunately eventually lead on to endometrial cancer if we didn't add that in. Many women also will ask about testosterone for libido, and there is some evidence for that, and in selective cases we may add in that. Hopefully the HRT, once it's optimized and in the right formula for that particular woman, can really help those symptoms, but we're also holistic and look at lifestyle measures as well, and sometimes there's other things we can do to help with sleep. In women that can't have HRT, and that's commonly women that have had estrogen dependent cancers, or women for other reasons that maybe don't want it or for other reasons can't have it, then we can look at non-hormonal alternatives, and they can also be very effective. So all in all, we can find a personalised way of addressing the menopausal symptoms, and usually this is very effective, and usually we can find something to suit you.